You're listening to Detroit Today on 101.9 WDET. I'm Stephen Henderson, your host, and I'm really glad you've decided to join us. We are in the dining room of the Grand Hotel on Mackinac Island for the 2023 Mackinac Policy Conference. You know, there are lots of people who come to this conference every year, and then there are people who are real fixtures at the conference, not just because they come, but because of the presence that they command when they're up here. I'm sitting across right now from one of those people. He is the county executive of Macomb County, Mark Hackle. Welcome to Detroit Today.
Thank you, Stephen. Appreciate it. I really like the baseball cap with the throwback Tiger
Throwback
logo.
68 logo.
I like that. That's really nice.
Yeah.
I just noticed it.
You know, it's really hard to find them.
It is.
I need a replacement, and I'm having a hard time. I got to call the Illiches to see if they'll find one and sell it to me.
That stands out. Well done. Well played.
So you are somebody who, as I said, has a real commanding presence up here. You've made a lot of the opportunity that this affords us as people who are often not able to sit down and have really frank, extended conversations. And we come here, of course, to be able to do that. But one of the coolest things about your presence here is you always have a billboard on I-75 or a billboard or two talking about something that you think is important. I did not drive up this year, so I didn't see them. So I want you to tell our listeners what your billboards were.
Yeah, we've been doing it, so 11 years into it, and the reason for it was just exactly what you said. Sometimes they come up here, and everybody has their own mindset, their own agenda, what they're looking for, and the policy conference always has, their theme, for what's happening. But we also want to kind of interject what's happening in Macomb and what's important to us. But again, this year's theme is something I think that's important, not just to Macomb County, the region, the state, but even across the country. And it's just a mindful approach to mental health. And what do we mean by that? Everybody says we need to do something about the challenges, the issues we see in the communities about mental health. And in Macomb County, we are not saying we need to do something. We are doing something. And so as a county, we have a responsibility to run a county jail. But we've recognized that county jails, when they closed these institutions around the state 20, 30 years ago, thinking there was going to be supportive services on a community base, it didn't happen. And so what happened is there's been a lot of challenges, and it just progressively have gotten worse with our schools, with our workplaces, and we're seeing it kind of transfer into the healthcare systems where they're trying to figure out how do they handle patients that are coming in with mental health issues. But the most impacted was law enforcement, specifically jails. And with that, there are a lot of people with mental health issues in our jail. We're going to be fixing our jail, but with that mindset towards making sure that the people that are in those facilities are getting the proper care, but those that don't need to be in there are being handed off to community corrections as well as community mental health to figure out how do we provide better services for them within the community.
So this is a problem I feel like, there's no question we have every community in Michigan struggling still to try to figure out how to manage this issue since we closed much of the public infrastructure that supported people who are struggling with mental illness. But I also feel like it's the kind of thing that you can't just kind of scratch the surface of. It is a really deeply rooted problem in our communities. Its tentacles reach to all kinds of other things that government and business need to pay for. How did you decide where to start? And what is it about what you're doing that you think turns the needle on this issue?
Yeah, 30 years in law enforcement, after I spent those 30 years, we realized when they were closing those institutions, I was a sergeant at the department, and back then, the sheriff, my father at the time, said, we are going to be the new institution for these facilities because there is no safety net. And boy, that came true. And over the years, we've seen it progressively get worse. But, being the county executive for 12 years, I hear what's happening in the schools. I listen to those that are in the healthcare profession, and everybody's saying the same thing. This is a broad-based issue, and everybody's dealing with it. Well, I look at it as we can continue to provide support and kind of ideas and thoughts as to what can happen, for those other entities. But the reality is, as a county, we have a responsibility to do something if and when the opportunity presents itself. Well, that opportunity has presented itself. We're 20, 30 years into a facility that's needed to be fixed, and kind of a new facility. So with that, we know we have to fix that jail. If we do something that has a component to making sure we're providing services in this, not just a brick and mortar, but the services provided for mental health, it will have, or it will resonate to, I guess, lessen the impact that we're seeing within the community in all those other areas. And so with that, we're taking the first step forward on this. I think it's going to be monumental. I think you're going to see others look to say, you know what, we need to do something with our facilities, not just throughout the state, but probably throughout the country. And Stephen, I take it a step further. As the county sheriff, when somebody was, remanded to the custody of the sheriff, when a case is adjudicated, if they're going to stay there because it's a misdemeanor and the judge says you're sentenced to the county jail for a period of time, we got to manage them while they're there. But if it happens to be a felony and they're going to be transferred to the state, what we used to do, and we currently do, most of the 83 counties, is send that body to the state without any real understanding as to the mental health issues. And so their placement issues are, it's like, we got a body here, what are we doing with them? Now they've got to do a full assessment, make a determination. We're going to be handing off a body with that assessment and the treatment that's been provided. So the state now is getting somebody that is a known commodity. They're going to understand more about that person.
It's a really progressive approach to the idea. Talk to me about the cost and where you find the money.
Great question. Again, we were fortunate. We looked at the money that we got from the CARES funds. Wayne, Oakland, Macomb, Kent County, and the city of Detroit got CARES fund during the pandemic. $152 million Macomb County. I'll just stay specific on that. And we did things for businesses and PPE and test sites and vaccination clinics and all this stuff. That $152 million was transactional. It went so quick. It was gone, and there was really nothing to show for it. Well, when this money came down and they were looking at the new ARP money that came our way, the initial conversation was do something that's transformative rather than transactional. And so we talked to our board of commissioners, Don Brown, the chair of that board, as well as the other members, and said, we need to fix this jail. Let's do something transformative with this funding that has an impact on mental health and substance abuse issues. And we got their attention. They were supportive of it, realizing if we can do something that is transformative with this funding to support that, let's look at it. And so we realized $130 million of funding that's coming from the ARP funding, as well as $50 million from county funds that we have in our general fund, and leaning into the state for support on this as well, knowing that this is going to help them down the road when we transfer prisoners to their facilities. We believe we have the funding for the brick and mortar, but now working with community corrections and community mental health, they have funding to support what we're talking about on the programmatic side. And so we're very fortunate to have those working relationships to make sure that obviously down the road, after we build a facility, we know we're going to have funding to help deal with the programming.
Yeah. I want to talk about Macomb and how it's changing. I grew up in Detroit and in Southeast Michigan. I remember Macomb very distinctly from my childhood and what it was. And when I go to places that I thought I knew in Macomb, they're totally different. Now, there's a demographic change taking place. There's economic change taking place. Talk to me about what all of that means, and especially from your chair as the county executive.
Yeah, I was born in Detroit, actually a hospital in Detroit, but grew up in the southern part of Macomb County, the city of Warren. And you're right. I mean, my 60 years of being in Macomb County, I've seen the transformation, and the numbers show it. I mean, if you actually look at it statistically, data-wise, the population growth, we're over 900,000 people right now, but it's a different type of 900,000 people, far different than what it once was. And so, we're seeing the diversity within Macomb County has expanded. It's exploded. I mean, it's incredible. In fact, one of the telling signs is, we use this statistic or figure, which is kind of significant. Right now in Macomb County, 1 in 9 people living in Macomb County are foreign-born. So they don't even come from, being kind of regional migration.
Right.
We're seeing people coming from other countries living in Macomb County.
Wow.
So
almost 10%. Well, more than 10%.
It's over 10%, correct.
Wow.
And with that being said, you kind of look at that and I'm thinking those numbers are pretty substantial. And my question is always, why? What is it? People don't move where they don't feel welcome. They don't go someplace where they don't think they can raise a family or they can find, an opportunity, in that location. And so, I could talk about, everything I think is good about Macomb County and why people are moving there or whatever. But I think the numbers show that there's a reason why people are continuing to find this is a place that is welcoming and a place for them to want to go ahead and raise their family. So, when we talk about educational attainment levels have gone up, we're seeing that household income's gone up. Right now, when you talk about the workforce, we had historic highs in workforce numbers. 420,000 people now in the workforce. Our unemployment is incredibly low. In fact, that's an unfortunate reality because we have 35,000 jobs available right now in Macomb County.
You can't fill them, right?
And so we're going to continue to try to figure out how do we encourage people, not so much from the regional migration, because that doesn't help the region, but how do we get people from other states to want to move to this region? And, with that being said, not just even from, from this country, but from overseas that are willing to want to come here and look to raise a family. So we welcome that, and I think you've seen a drastic change in Macomb County over the last couple of decades.
Do you find that county government needs to provide different services or more support, given the changes, the demographic changes that are happening and the economic changes that are happening in the county?
I think it's both. I think and we need to support those that want to bring those supportive services. The Chaldean community, incredible services that they provide, and it's not just for the Chaldean population that's being that's coming from overseas. Their outreach is incredibly supported by our health department, by our Macomb Community Action, our Health and Human Services organization. So we tend to see that there's been a great, interest on behalf of not just the county providing services or the local units of government. We're finding that there's the private sector and those that are from other countries or different cultures saying, we want to contribute. We want to be part of this reasoning as to why people find it attractive to live in this area, to get people to feel like, they belong and help them, integrate into to the communities.
Yeah. I'm talking with Mark Hackel. He is the county executive in Macomb County. We are in the dining room of the Grand Hotel on Mackinac Island during the 2023 Mackinac Policy Conference. We talk all the time about regionalism and our successes and our challenges with regionalism in Southeast Michigan. You've been a key player in that conversation now for a long time. How do you think we're doing? Are we winning that battle? Are we working together better?
I think so. I think we're getting there. If you look at, Macomb County, every asset that is out there that's regional, whether it's Great Lakes Water Authority, the Detroit Zoo, we talk about Cobo, Huntington Place. We're looking at, the RTA. Macomb County has always been supportive of transit by, obviously, the millage they had back in the 90s with SMART. We're all in. We're finally seeing Oakland County now has finally
no
opted.
Opt-outs, right?
Wayne County's still got their challenges with the opt-in part of that. In fact, prior to coming here, I was just meeting with Dave Coulter and Warren Evans. We just had a conversation about some federal money and state money that might come in to help enhance, what's going on with the transit that we have currently in place. So, there's constant conversations about, how do we continue to be regional, supportive. I'm working to help Wayne County right now with the issues they're having with the JJC, their juvenile justice facility in the state. So with that, we leaned into supporting them, and so we're going to be taking some of those kids into our facilities here in Macomb County. Oakland County is helping us with some issues we're dealing with our medical examiner's office. So again, there's always the cooperation and kind of that, that willingness to figure out how do we partner and how do we support one another. Again, a great working relationship with Dave as well as Warren and even Mike Duggan.
Yeah. So you are now the senior member of what we used to call the Big Four, right? Or the Big Three. I can't remember what we called it. When up here, it was Big Four. Every year, it was a big deal that we have all four on the stage together up here on Mackinac talking about things. What's changed in the time? I mean, I remember when you were new and you were the newcomer to that conversation. What's changed?
I think the thing that changed most for me is I feel more comfortable with it. I mean, my background has been law enforcement, public safety. I was teaching in academies and at the Wayne State and Macomb Community College. I grew up in law enforcement. So getting into this county executive role, it was a new role. In fact, we never had one. And so now you're
the first county executive.
So with that, it wasn't so much you're like watching what's going on in Oakland or Wayne. We had a document that you had to figure out what does it mean. How do we make sense of it? And you're kind of working with the legislative branch, kind of taking away what they once had because they were doing both the executive and legislative roles. So there was a huge challenge early on in trying to understand what my role was, but also marketing, promoting the county, and trying to figure out how do we build on the things that that we believe we are, and how do we grow the county in many different ways, but also reaching out to my counterparts. And back then it was Brooks Patterson, it was Bob Ficano, and they'd been around a long time. So getting up on the stage with these guys, I'll admit I was nervous, a little apprehensive because I didn't know to the extent that they understood, about healthcare, economic development, roads, and all the issues that are surrounding the infrastructure concerns. So, but I learned quickly because of the people that I was able to bring on board within my organization administration. I learned from them, and then paying attention and seeing what works and what didn't work. So I feel much more comfortable now having conversations and trying to figure out where we headed because I learned to ask a lot of questions, listen, pay attention, and try to figure out, what is the best solution moving forward, as to try to figure out how do I deal with the politics. I tend to shy away from, doing things that are politically correct.
Pesky politics.
I know, it gets in the way.
So before I have to let you go, what do you think is the next step on transit? We had this great vote recently where we got rid of the opt-outs in Oakland County and some more money to do some really interesting things, but we're still a long way from, I think, the vision that some of us were embracing after the passage of the RTA, and we just have never gotten that going. We don't really have great regional transit planning or execution. So how do we keep the momentum going, I guess, at this point?
Yeah, I tend to look at it from the perspective of what's worked for Macomb County. And SMART, being our provider, has always been there anytime we're looking for something more, if we decided to add. Because when we first started, it was about a third of a mil, and now we're up to a mil that we're paying. But again, it was progressively because we're adding certain assets. I think the people in Macomb County would be more than willing to take a look at and vote on or support, an enhancement if they understand exactly what that plan is, what are we looking to do. But you also got to factor in, and far be it for me to tell any county what to do and how to manage their affairs. But you mentioned Wayne County. They're still the only one that is the opt-out. They're not together. Like
there are communities that can say they don't want to participate.
Right. And I'm not the one that's trying to figure out how they pull that together. But we did it. Our Board of Commissioners put it on the ballot countywide, and obviously a decision was made. Oakland County just did the same. Their county board put it on the ballot, and that's how that happens. So again, whether Wayne County does or continues to decide not to, that's up to Wayne County. I don't inject myself, but having everybody on board as a region where they're all, everyone's paying the full mill, and you're getting those supportive services, and there are no communities opting out. I think that's the level playing field that's needed before we start moving into.
So
other
how
assets.
do we connect that though to RTA, which we passed and decided that was how we were going to do it, and we haven't done it.
Yeah, I don't think it's going to take the RTA to do that. I think it's going to take, probably Wayne County initiative to do something to make sure that everybody is on board first, and then talk to those that are part of this SMART system as to what do we need to do to enhance. Because I think that's where you possibly are going to get buy-in from the residents from the entire region if they see that everybody's paying their full mill. It's fully connected, which is what we've always talked about first. But Macomb has always been fully connected from the 1990s. And so with that, then the opportunities to enhance based upon what we're looking for, if it's routes to the airport or rapid transit up and down some of the major corridors. The opportunities are there, but the people need to see that everybody's on board first before we start adding another layer.
Yeah, well, we definitely need a lot of things, and the whole region gets held back because we don't have them. So
yes, and even the infrastructure itself. We're talking about roads, bridges, and then the underground concerns. I mean, there's a lot of looming concerns because it's not getting any better. And the question becomes, how do we fund that? Becomes the biggest concern, because there isn't a bridge or road we can't fix, but we need to figure out how we fix the funding to support that.
To make sure that they're well cared for. Sure. Okay, Mark Hackel, Macomb County Executive. Always great to catch up with you.
Thanks, Steve.
Thanks for coming by here on Mackinac Island. All right, we're going to take a quick break, and when we come back, we'll have more of Detroit Today. Stay where you are.